Good morning, good afternoon. Welcome to the Black African American media briefing about COVID-19 vaccines. Just a few notes before we get started. Please submit your questions in the question and answer chat box. That'll be coming up later in the event at the bottom of your screen. Any additional questions, we'll get them answered. Just email Daryl, D-A-R-R-Y-L, at cmredge.com. And in addition to that, this session's being recorded. Discussions are on the record, just to let you know. The recording will be available upon request. Now, on behalf of the U.S. Department of Health and Human Services, I'd like to give the deepest appreciation and thanks to the African American media and all those of you joining us today for the press briefing. You all play a very big and enormous role, vital and instrumental, bringing accurate and life-saving information to our communities, particularly at this time when we really need it the most this summer. My name is Daryl Sellers. I'm the Director of Public and Media Relations for Creative Marketing Resources, Inc. We're a Black woman-owned marketing communications agency and one of the nation's leading agencies for engaging Black African American communities with critical public health information. Since being founded in 1995, it's been our mission and duty to develop innovative, culturally competent campaigns that lead to real and positive societal change. The We Can Do This campaign is nationwide. It's an initiative to increase public confidence and uptake of the COVID-19 vaccines through a nationwide network of trusted messengers and consistent fact-based health messaging. The campaign helps the public make informed decisions about their health and COVID-19, including the steps and how to protect themselves, loved ones, and communities. Our duty has been to create messaging for Black communities across the U.S., and that's delivered with our unique voice in mind. Together, we can do this and save Black lives. Today, we have the great pleasure of hearing from trusted Black voices from the medical field who are the leading effort messengers to ensure our health and well-being. These heroes and sheroes have been instrumental on the ground from the start, working rigorously with local partners to ensure vaccine access, to build confidence in the vaccines, and create health equity for our Black communities, really crucial at this time. Again, we're proud and honored to have you join us at this briefing. This is our opportunity to amplify Black voices who can educate our communities about the importance of the COVID-19 vaccines, factual and up-to-date information as well. This is critical in helping us save Black lives and all lives as we push through this pandemic. We extend and thank the U.S. Department of Health and Human Services for prioritizing this event and ensuring this campaign authentically reaches our Black communities. Together, we can do this. Now, I'd like to introduce our first speaker, Georgetta Dragouilliou, who serves on the COVID-19 Public Education Campaign with the Department of Health and Human Services. The Senior Fellowship is dedicated and instrumental to bringing top industry experts into government to improve services for the American people. Before joining the Public Education Program campaign, she worked with the All of Us Research Program at the National Institutes of Health, where she designed and led national and regional campaigns focused on recruiting communities that have been underrepresented in precision medicine research. Georgetta previously served as a communications director and spokeswoman for the Office of the Assistant of Public Affairs, ASPA, in 2016, honored to continue her service in this defining role in our country's history. She graduated from the esteemed University of Chicago and Harvard University as well. Welcome, Georgetta. Thank you for your partnership today and teaming up with us.
Thank you, Daryl, for the kind introduction, and good afternoon, everyone. As Daryl mentioned and correctly pronounced my name, Georgetta Dragouilliou. I work on the COVID-19 Public Education Campaign here at the Department of Health and Human Services. And I'm so grateful that so many of you have taken time to join us today. I'll just briefly share with you some of the ways that we're reaching African American communities with important facts about getting vaccinated and protecting themselves and their loved ones from this terrible disease. An important pillar of our strategy is partnering with trusted messengers to reach underserved, hesitant, and multicultural communities with life-saving information about vaccines. Our research shows that every single population we're trying to reach considers doctors and other healthcare professionals to be their most trusted messengers. I know that has been true for me as I navigated this important decision with my own family, and continues to be true for so many of the individuals and families that we're trying to reach. That's why I'm so honored to be here today with all of you and with such dedicated physicians who can speak to the monumental work that they're doing across the country in their respective communities. Every question that African-American communities have about the vaccines matters, and we're dedicated to making sure that we're working together so that people feel heard and have their questions answered. Our work with local doctors and healthcare professionals has generated more than 372 original stories for a reach of more than 186 million broadcast and online impressions. And I just want to say with this team, we're just getting started. Just this month, we've expanded our outreach efforts with the help of dozens of African-American doctors from the National Medical Association. And you'll hear from Dr. Villanueva a little bit later. This initiative will continue to elevate the voices of Black health professionals in some of our country's hardest hit communities. August is a critical month for our country as we work hard to limit the spread of COVID-19 in the face of the Delta variant, and as we get ready to go back to school. We look forward to continuing to work together and urge you to partner with us in helping your viewers, listeners, readers, neighbors understand the benefits of these vaccines and protecting themselves and the people that we love. Along with other personal safety measures that are proven to be effective, vaccines can help us get through this pandemic with fewer lives lost, fewer families in distress, and less impact on communities of color across the nation. Together, we can do this, but we definitely need you to help us do it. It is now my pleasure to introduce Dr. Cameron Webb, who is serving as a Senior Policy Advisor for Equity on the White House COVID-19 response team. In this very important role, Dr. Webb is helping to shape national discourse and management of the COVID-19 pandemic. And I want to say that I have been personally moved by his incredible hard work and passion to help save lives. He's a yes man. He's never said no to an opportunity that has come his way to reach his fellow communities and the people of this country. So with that, I'll leave you to Dr. Webb. Thank you.
Well, thank you so much, Georgetta, and it's great to be with you all this afternoon for this conversation. It's a really critical one at a critical moment. And so just to revisit, again, my role is Senior Policy Advisor for Equity on the White House COVID-19 response team. But that role is part of what I do. I still see patients clinically as an internal medicine doctor at the University of Virginia, where since last March, I've worked on our coronavirus unit. And I remember back last March, one of the first experiences that we had when we began seeing COVID patients was looking at the list of patients in our hospital and seeing how many of them looked like me, the disproportionate number of Black and brown patients that we had in the hospital at that time. And it really sparked a lot of those conversations that we've been having all over the country about why this virus has exacted such a terrible toll on communities of color in particular. And ultimately, that's what led to me wanting to take this role to try to do as much as I can to press toward equity. Also in this conversation, I want to level set a little bit about what we mean by equity. And health equity specifically, of course, we're talking about everyone having the opportunity to be as healthy as possible. That's the framework that we use when we talk about equity. And I think equitable opportunity includes equal access to and distribution of resources like vaccines and therapeutics and even COVID tests. And so it's important for us to make sure that we're having that conversation the right way. And that's where you come in. And together through these conversations, through sharing information, both from us to you and from you to the communities that you reach, we're hopefully going to be able to fight for equitable health policies, programs, and systems that reduce some of the poor health outcomes, that prevent health disparities, and ultimately that benefit our society as a whole. Now, I want to say also, the frame for today, I'll talk over the next couple of minutes a little bit about where we are presently. Certainly this Delta variant has been a game changer. And in my work on the White House COVID response team, it's something that we're spending a lot of time on. So I'll give you a bit of an update there, and then we'll talk more through kind of some of the dynamics by race and ethnicity, specifically addressing issues in the Black community. So we'll start with the Delta variant, and of course, it's become a really major factor that's adding to the challenges we're facing in this pandemic. I tell people all the time, this is almost a new pandemic. If you look at the rate of spread, the case rate that we're seeing with Delta variant, it is really incredible how different it is. We compare it to the wild type or the original coronavirus that we saw back last spring, in spring of 2020. And this version, you get about 1,000 times the viral load in the nose of individuals when we're swabbing looking for virus. And that's significant because it spreads faster, and we're seeing that it's affecting younger individuals and they're getting sicker. And so it's really important for us to recognize the new threat that's in front of us. Certainly it's become the dominant variant in the United States. If you go back to late May, it was about 2.7% of our cases of COVID. And then as of this morning, we're seeing it's certainly well above 93% of the cases of COVID that we're seeing here in the United States are this Delta variant or its sublineages. And so that's a really important note. It is the version of the coronavirus that we're dealing with these days. And it's the reason why we're seeing this significant uptick in cases. And I'll talk about vaccinations in a little bit and why that's such an important dynamic here. But keep in mind, COVID-19 cases, we were really making great progress, but we've seen them increase by over 145% over the last few weeks. And we're seeing hospitalizations also climbing in all 50 states. Again, I worked in the hospital over this past weekend, and we're starting to see more COVID patients coming in again, because particularly for folks who are unvaccinated, they're still very much so at risk. And as I mentioned, we're seeing younger people, and so we're seeing more younger people get COVID and require hospitalization than we saw with earlier variants or earlier versions of this virus. But there is a silver lining. There is some good news here. It's that the vaccines that we presently have do still seem to be very effective against this Delta variant. That's an important note because, whereas originally the Pfizer vaccine was about 95% efficacy against the original coronavirus or SARS-CoV-2 virus, what we're seeing now, it's about 88% effective, which is still an incredibly effective or efficacious vaccine, but a little bit of a difference there. It's the reason why we will continue to see those rare breakthrough cases, but that is going to continue to happen because no vaccine is 100% efficacious. But just the same, understanding these vaccines still work, they work really well, and it's still an important part of our strategy to really fight back and beat back this pandemic. I think the nature of how fast this is spreading, though, when you couple it with the current vaccination rates, is the reason why this is such a critical juncture, such a critical moment in the Black community all over this country, where we are seeing lower vaccination rates. And I want to also acknowledge where we are. It's August. I think for a lot of folks, it's the summertime. Kids are heading back to school. So there's a lot of fatigue from COVID, and people are wanting to get back to normal. And I understand that. But I think that this is such an incredible moment for us to recognize everything we've learned over the past 18 months of dealing with this pandemic, the approach to risk mitigation through mask wearing or maintaining physical distance or avoiding public or crowded spaces. Those are important tools for us to keep in mind as we're navigating this newest variant and all the damage that it's causing. Now, I want to also put this current pandemic in the context of broader social and racial inequities with regard to healthcare. I think that we know is that there have been inequities in heart disease, in diabetes. We're seeing it in lung diseases, in cancer mortality, HIV/AIDS, in so many different spaces. We've seen these disparities over time, and COVID has certainly been no different. Early on in this pandemic, we were seeing case rates that were 3 times higher in the Black community, 4 times higher in the Latino community. And some of that has improved. If you were to look overall across the country at this point, if you look at all of the cases of COVID where we have race and ethnicity data, about 11.6% of the cases that we've seen have been in the Black community, and that's compared to the Black community making up 12.5% of the population. So we're seeing that has improved to some extent. And I would contrast that in the Latino community, where about 28% of the COVID cases that we've seen are in the Latino community, and that's compared to about 18% of the population. But that's not telling the full story. You know, we still are seeing that the deaths are higher in the Black community slightly. About 13.8% of the deaths that we've seen from COVID have been in the Black community. And yes, that's an improvement from where we were in the earliest days of this pandemic. But at the same time, any life that's lost from COVID is a preventable life lost at this point, now that we have these highly safe, highly effective vaccines. And so it's important for us to keep track of where we are, and understanding that even when you look at hospitalizations, when you look at the people who are getting really sick from COVID in different communities, we continue to see differences in those rates. And so this is not a benign experience. This pandemic, this virus can cause a lot of damage, and we have to keep that in mind. I'll spend a minute or two on vaccine access for Black Americans, or kind of this notion of vaccine hesitancy. I like to describe it in terms of the 3 C's, which are kind of a framework for us to understand why people aren't yet vaccinated. And the first is thinking about vaccine complacency. In a lot of communities, we hear people say that, well, I'm young, I'm healthy, I take care of myself. I haven't seen a lot of people get sick from COVID. I'll be just fine. And that complacency is part of what's leading them to not get vaccinated. For other individuals, it's a matter of vaccine confidence, which is confidence in the safety of the vaccines and their efficacy. And we'll hear questions about, the speed with which the vaccines were developed. Even though the technology was under development for decades, we'll hear people ask those questions, or ask about, emergency use authorization versus full approval. Even though all the data tells us these vaccines are incredibly safe, it's important to keep engaging those conversations. And then the third C, so complacency, confidence, and then the final one is vaccine convenience. And that's when we talk about access. And yes, vaccines are everywhere in our communities at this point. We see them in pharmacies and community-based organizations, faith-based organizations. We've got barbershops and beauty salons that are helping in the vaccination effort. And so across communities, there is a lot of access to vaccines notionally. But there are also still barriers to access. And that's why we're doing so much work around ensuring paid time off for individuals, or access to childcare or transportation. We're also really investing in these trusted spaces for folks to get vaccinated. Trusted spaces like, faith-based organizations, working with churches, working with community-based organizations, and also, like I said, working with barbershops, beauty salons, meeting people where they are. That's really going to be the key. But we know that the vaccination rates still are different by race and ethnicity. And I think that that's something that's important for us to always note. In the Black community, if you look, again, it's about 12.4% of the population is Black, but about 9.7% of the folks who've received at least one dose are Black. And we've seen improvement of late. Over the last 2 weeks, that number is actually about 15.3%. So we're seeing it trending toward more people from the Black community getting vaccinated as a percentage of the vaccinated population over the last couple of weeks. But it doesn't mean that we are there yet. We still have a lot of work to do. We have to keep pushing, have to keep pressing. Part of the good news about seeing that higher percentage over the last few weeks is the fact that we know that for individuals over the last 2 weeks, we've seen an increase overall in vaccination. So we are picking up some speed, but we don't want this to take too long. We don't want it to be too late. So that's an important thing for us to talk about. As I come to a close, I just want to talk briefly about the role of the press, and also the current dynamics with vaccine confidence. And first, vaccine confidence is growing. We've seen that idea of a movable middle shrinking over the last several months. More and more people from the Black community are saying that they are vaccine ready, either already vaccinated or want to get vaccinated as soon as possible. And from some studies, we're seeing that number is nearly 60%. So almost 3 in 5 folks from the Black community are feeling like they're vaccine ready to go. But that still means that we've got some folks that we need to reach in order to make sure our communities are protected. We still have a lot of folks in that wait and see category. And what that means is that we have to take the time to answer their questions, or as Black media, really make sure that you're getting good, trusted, factual information out there. One particular point that I like to make is that a lot of times we keep reinforcing this notion that maybe Black people are more hesitant, when the data doesn't bear that out all the time. I think that's when you answer people's questions, you learn that people are willing to get vaccinated. So we want to make sure that we're telling the right story. And so many of you have been leading the charge on that, on really diving deep in communities. And so I applaud you for that and want you to continue getting the right stories about the experiences of the Black community out with regard to this pandemic, so that we can also react and respond in real time and meet those needs. It's critical. It's a critical moment for us to slow the spread. This is the season of back to school and back to work, and we have to make sure that as folks are going back into communities, back into spaces, we have to protect folks. I'd be remiss if I didn't mention that among that younger age group, adolescents, 12 to 17, we are seeing lower vaccination rates in the Black community. And a lot of times it's because parents of those Black children are often saying they're more likely to be in the wait and see category with regard to having their children vaccinated. We have to make sure we're getting good information, factual information, everything that we know about the safety and efficacy of these vaccines for children. We have to get that to parents, because pretty soon that 5 to 11 age range is going to be available as well. And we want to make sure that our kids are protected just the same. Now, with that, I just want to thank you all for your partnership, for all of your hard work in telling this story and helping to get shots into arms and helping to make sure that people recognize we're not here to sell vaccines, but we're here to help end a pandemic. And that's the moment that we're in. And I think the best way to say it is that together we can do this. And I think that's the name of the game here. Now I'm going to turn things over to Dr. Rachel Villanueva. She is a good friend and colleague. We've been working together for the last decade through the National Medical Association. I'm proud to now call her the National President of the National Medical Association. She's also a Clinical Assistant Professor of Obstetrics and Gynecology at NYU Grossman School of Medicine. Just an incredible leader and voice in leading the Black community and representing Black physicians. I'll turn it over to you, Dr. Villanueva.
Thank you so much, Dr. Webb. I'm going to actually have you as my personal intro person from now on, because that was the best intro I've ever had. And good afternoon, everybody. It's really a pleasure to be part of this virtual conversation. And it's really an honor to be among this panel of experts that continue to move the needle in the space of health equity, particularly now as it relates to the urgent needs of communities of color in relation to COVID-19 in testing, education, and access, and most importantly, vaccine confidence and uptake. The National Medical Association represents the collective voice of African-American physicians across the country, advocating for the interests of Black patients and underserved patients since 1895. The NMA continues to advance medicine through education, advocacy, and elimination of health disparities that limit the full capacity and potential of communities of color. We are committed to the health of Black communities, and at the heart of this now is putting an end to the COVID-19 pandemic. The pandemic painfully highlighted the racial health disparities and inequities that have long existed in our healthcare system, leading to disparate outcomes in the health of Black and Brown communities. COVID-19 has unmercifully ravaged our community. We were disproportionately impacted, contracting, being hospitalized, and dying at increased rates. Many in our community were essential healthcare workers or essential workers at increased risk. Many could not have the luxury of working remotely from home, and living conditions increased spread in multi-generational families. We actually all breathed a sigh of relief when effective and safe vaccines became available, until we realized that the most vulnerable, our community, had some of the poorest vaccine uptake numbers in the country and still do. And why is that? Well, actually, before I get to the why, I do want to make sure that I get to the most important message today, which that vaccines are safe, effective, free, and we need to make that known to our communities. Millions of Americans and individuals around the world have been fully vaccinated safely and are protected from the worst effects of COVID-19. Vaccines will protect against hospitalization and death. It is important that we make sure the message gets out, and that the message that the pandemic is actually not over. If people are not vaccinated, the Delta variant will find you. We know it's more transmissible and infections are surging in the unvaccinated. So we are encouraging all eligible Americans over the age of 12 to receive a vaccine if they have not already done so. Vaccination, along with continued mitigation strategies, such as wearing a mask and social distancing, will protect and end the pandemic. So now let's get back to that why. Why aren't African Americans getting vaccinated? Why, despite being at higher risk of severe disease and death, is the vaccine uptake still poor in our community, even though it is improving, as Dr. Webb said? Well, we are honestly not surprised. We know that Black and Brown communities have been subjected to an unequal healthcare system for many years, including barriers to access, implicit bias, and structural racism. Exclusion of Black physicians in this system was actually the reason for the creation of the National Medical Association. We know that many distrust the health system because of poor treatment in the past. And we also know that our community has been subjected to deliberate misinformation that has caused doubt about the safety and effectiveness of these vaccines. While the narrative in the media sometimes blames poor uptake on Black patients themselves and their hesitancy, research, as Dr. Webb also mentioned, research has shown many in the community just need their questions answered and their concerns validated. And then they are the willing and ready group to get vaccinated. They need credible information. They need their questions answered by people that they trust, those trusted messengers. We need to improve access, dispel this misinformation, and educate our communities. And as Dr. Webb also said, as I'm referencing many times, I prefer to discuss improving confidence as opposed to focusing on the perceived hesitancy of Black and Brown communities. NMA physicians know that we are trusted messengers in our communities. Understanding the potential for mistrust of the system and of vaccines during their creation, the NMA actually created its own COVID task force to investigate vaccines, safety and efficacy with a particular lens to our community in general. We met with manufacturers, the FDA, vaccine advisory committees, and in the end found, as they are, them to be safe and effective, and we encourage our patients to get vaccinated. So it is really incumbent on the media to highlight minority organizations such as the National Medical Association, such as the National Hispanic Medical Association, that are advocating for their communities. The NMA represents local Black physicians across the countries of all specialties. We're the individuals that Black and Brown patients have trusted to take care of them, and we need for them to continue to trust in our care. We know that the decision to get vaccinated is a personal one. We need for our communities to trust us to have that conversation, to allay their fears, and to encourage the decision to get vaccinated. I ask every patient that I see every day in my office whether or not they're vaccinated. I listen to their concerns, I validate them, and provide credible information about the vaccine. Personally, it took me many months actually to have my own mother have enough confidence to get vaccinated. There were many, many discussions with her. I even had to take off work to bring her so that she would feel safe when she got the vaccine. And that was really important to me. And I'm grateful that she finally agreed to accept the vaccine. So the National Medical Association is leading the way, along with other doctors and health providers in the fight against COVID-19, and importantly, closing racial gaps that exist for vaccination. Our physicians are desperately advocating for and educating our patients through local and national events. Our physicians are proudly joining the We Can Do This campaign to increase public confidence in the uptake of the vaccine while reinforcing mitigation strategies in vulnerable populations. We are using facts and science to educate patients and support informed decision-making about the vaccine. We want to protect our family and friends, and importantly, protect those most at risk who may be unable to take the vaccine, such as children under 12. The NMA has joined with nearly 60 other healthcare professional organizations in supporting a mandate for all healthcare workers to receive the vaccines. And we know many of these healthcare workers are members of our community. As an OBGYN, I am passionate about having all pregnant and nursing persons getting vaccinated to protect themselves and their babies, and so grateful that our governing bodies, the ACOG and SMFM, recently did the same. We want all eligible Black Americans to have their questions answered and to get vaccinated. We need this message to be clearly stated. Together we can, we absolutely must, and we will do this. I firmly believe in the power of the collective, and we need this collective to surmount the pandemic. I really thank you for the opportunity for sharing these thoughts and presenting the concerns of the physicians of the National Medical Association. And now I have such an honor to turn things over to my Haitian sister, Dr. Michele Benoit-Wilson, someone who I've known since we were medical students, advocating for the same things we're doing today, health equity and the elimination of disparities, and advocating for our community. Dr. Benoit-Wilson is an OBGYN with WakeMed Health in Raleigh, North Carolina. She's so impressive and always has been, and now is part of a sister circle, a group of 6 Black female doctors who help to vaccinate thousands of Black residents in the Raleigh-Durham area. I'm so excited to hear more about her message and to amplify what she's done. Dr. Benoit-Wilson.
Thank you so much, Rachel. I do miss our Student National Medical Association days way back when we knew and we thought we could change the world, and look at where we are right now in probably the most impactful health crisis of our time. So thank you so much for that kind introduction, and congratulations on your role as the president of the National Medical Association. I think what I would like to bring to this conversation is really a much more personal perspective. When we were in the middle of this crisis in 2020, one of my own personal experiences was having family members suffering from COVID. Prior to the information about masking being so important, my physician cousin was in the ICU as he was infected by a patient during a normal visit, prior to us really understanding the ramifications of what we were dealing with. And he spent 2 weeks in the ICU on a ventilator, and we were sure that we were going to lose him. Fortunately, he recovered. He's still recovering, but he's alive. And then a few months later, unfortunately, his brother contacted COVID. And he had a number of underlying medical conditions, and unfortunately he passed away in January. And so that was a 1-2 punch to our family, and the ramifications have been far-reaching. His mother, I believe, died of a broken heart a few months later. And so I try to bring that personal perspective to my plea to our fellow community members about the importance of vaccination. 2020 was a tremendously difficult year for us as healthcare providers. This sense of helplessness as we were seeing the ravage that was happening to our communities. We were at the cross point of not only a health crisis, but also a racial reckoning in this country. And it was extremely difficult to cope and manage through both at the same time. So when January rolled around, and my colleague and fellow pediatrician, excuse me, but my colleague and sister, Dr. Rashida Monroe, she called upon us when she had the opportunity to volunteer during a vaccination event shortly after we were all vaccinated. And she called us with this urgent message and said, this has been a tremendous opportunity for us to be able to vaccinate our community members, but the people that I saw today were predominantly white. Where are the Black people? Where are the Latinos? Where are the folks of color during a very early vaccination event in January? And so she called upon our health system, WakeMed, and said, I personally know a group of physicians who are passionate about our community. I personally know people who will spend and want to spend their time helping other people. If you can get me the vaccine, we will bring people in. And so within a 48-hour period of time, we were able to essentially convert our next drive-through clinic where 1,200 people were vaccinated. We were able to register over 750 African-American and Latino people in a 48-hour period. And the way that we did that was we reached out to our community organizers. We reached out to our fraternities and sororities, our Black fraternities and sororities. We reached out to our Black churches. We reached out to our Black civic organizations and said, we have the vaccine. We know that in the state of North Carolina, where Black people make up 23%, we knew at that point, because North Carolina was collecting data specifically on race and ethnicity, that only about 11% of Black people, specifically, and 2% of Latinos had that early access to the vaccine. So we said that we wanted to be partners with turning that around. And with the help of our healthcare institution, our community partners, and our county government, our Department of Health and Human Services, we were able to ultimately vaccinate 14,000 people. Over 80% of them were Black, and a significant percentage were Latino as well. When we look at where we are today, though, that is our concern. We know that the Delta variant is wreaking havoc in our communities. We were so happy when we saw that our kids 12 and over were able to get vaccinated in June. My own 2 teenage boys were rushing to get the vaccines, like so many of our community members were rushing in the months prior. And we were able to get them vaccinated within the first week and get their subsequent vaccinations on time. But this Delta variant has changed the game. So many people have said, well, I'm going to wait a little bit longer. I'm going to kind of see and check things out, and I'm going to wait to see what happens, because things are going to get better on their own. And what we've seen is that, unfortunately, this has become a pandemic of the unvaccinated. Over 90% of our hospitalizations are of unvaccinated people, nearly 97%. We know that infection in fully vaccinated people is very, very rare. However, if you are vaccinated, there is data to support that we could potentially spread the virus to other people, even though our risk of infection is extremely, extremely low. So we've had to switch and pivot a little bit and say, where are the communities that are still hesitant to get this vaccination? Who are they? And what we're seeing is that the people who are at greater risk are fortunately not as much the elderly anymore, because at least in the state of North Carolina, 84% of our elderly population is fully vaccinated. But what we're seeing is that the folks winding up in the hospital are in their 20s, in their 30s, in their 40s. And those are people who we would have defined as being healthy people. So this is extremely concerning. 20% of the people getting hospitalized right now are infected and hospitalized are children. What is the difference between now and last year? Well, the difference is this Delta variant is extremely contagious. The difference is that in North Carolina, our schools, which are open year-round, we are seeing students in person. And we know how critically important it is to keep the option of in-person school open for our kids is. But we need to also make sure that we're keeping them safe. And the way to do this, the number one way to do this is vaccination. We have got to protect the children who have no choice and don't have the vaccination available to them yet, by, as a community, being vaccinated and protecting them. Masking is also very important. We have to encourage masking in our schools because we know how contagious this virus is. And we know that children can be severely affected. We're seeing more cases of children being seriously affected, hospitalized, and we've also seen more deaths in children. Our pregnant population is also at risk. And Rachel and I are both obstetricians and gynecologists. So our reproductive age women, our pregnant women are near and dear to our hearts. We encourage our patients to get vaccinated every single day at every single patient encounter. We know that the vaccine is safe in women who would like to get pregnant or are trying to get pregnant. There have been no increase risk of miscarriage that have been seen in women who have gotten vaccinated prior to pregnancy or in early pregnancy. We've not seen any increased risk in congenital or fetal malformations or higher risk in pregnant women who have received the vaccine. But what we do know is that pregnant women have an immune system that is compromised and is not as strong as it may be if they were not pregnant. And so we are seeing more pregnant women getting infected. We are seeing more pregnant women wind up in the ICU. And we are also seeing more people around them transmitting the vaccine. And so the solution has got to be vaccinating all of us and getting the message out that the vaccine is very safe. In closing, I just want to echo the words of my colleagues in really telling you that I honestly and truly believe that we will get through this together. We can do this together, but we also have to have a real and honest conversation with each other, with those family members and friends who are still unvaccinated. We have to be able to sit down and talk to them and really understand what questions they need answered. We as Black and minority physicians, we are available. I have not gotten paid for any of the vaccination clinics that I've been a part of, none of the educational seminars that I've been a part of. There's no financial interest in what we are doing whatsoever. We went into medicine because we wanted to serve our communities. And we know that Black and Brown physicians, we are the ones who are taking care of more Black and Brown patients. And so it is so vitally important for us to get the message out that vaccination is safe and it's necessary in order to keep us all safe. I'm going to turn this discussion over to Georgetta because I know that we have some questions and answers that we want to get to, and I'm anxious to participate.
Thank you so much, Doctors Webb, Villanueva, and Michele Benoit-Wilson for your important work, but also for sharing your personal stories with us. At this time, we'll be moving to the Q&A portion of our media briefing. We've gotten several questions already, but if you would like to ask a question, please type it in the question Q&A section on your window. And we have about 15 minutes and we will get to as many questions as we can in the time remaining. But we are dedicated to answering all questions and we'll follow up over email for those that we don't have time for. So with that, I'm going to go ahead and start. I think Dr. Webb, I'll pass this over to you. This is Stacy Brown with the Baltimore Times and the Black Press of America. The Lambda virus, of course, is now prevalent. And the question is, what should people of color who have suffered disproportionately from the COVID-19 pandemic, as you have mentioned, understand about this variant?
Well, I want to take a step back and say, we've had lots of different variants over the course of this pandemic. So whether it was, B117, which we now call the Alpha variant, whether it was, P1 and P2, which we saw in Brazil, or whether it's now this Delta variant that we originally saw in India and in the UK, all of these variants have had different characteristics. And I want to be really clear, even though I've seen increasing reporting on the Lambda variant, I think that it's really unequivocally true that the Delta variant is the variant that's in broad circulation here in the United States, that's causing the most damage, that's causing our cases, our hospitalizations, and our deaths. So it is still the Delta variant that is the predominant variant here in the country. I think that anytime we have emerging variants, understand that our CDC team is following them, tracking them very closely, both for the percentages that they make up in the communities where we see them, but also for any signal of any increased impact that they have, whether that's in hospitalizations or deaths. But to answer your question, what should people be doing? We've got some tried and true strategies. first things first, getting vaccinated is your best protection against these variants, because until proven otherwise, these vaccines work against the variants, and we continue to test the vaccines against the variants to make sure they're still effective. The second thing is that those other public health practices are still really critical. And so wearing masks while indoors, as Dr. Benoit-Wilson mentioned, that's still really important, for all individuals, because folks who've been previously infected or who are currently infected with COVID, even if they've been vaccinated, can still pass this on to other individuals. So wearing masks, avoiding crowded spaces, being mindful of where we see pockets of increased cases of any kind of variant. I think it's important for us to keep track of that. But I want to be clear, the Delta variant is the one right now that behaves differently, that we're seeing spread so much faster and is making people sicker. So really, I don't want people to be distracted from what Delta is doing.
Thank you. Dr. Webb, I think you already touched on this already, but there's a question from Josephine Reed about mask wearing, which I think you've addressed. But the other part of the question is, should the argument for people getting the vaccine be that, yes, you could still get sick, but not deathly ill or hospitalization?
Well, sure. I mean, and I can start that, and if anybody else wants to chime in, but yes, absolutely. The argument for getting vaccinated is, it's a couple things. Vaccines save lives. We know that. If you look at kind of the trajectory of deaths in this country, the deaths have gone down so significantly. And even though we're seeing an uptick in cases, and there's usually a lag of 4 to 6 weeks between cases and seeing deaths increase, our current modeling suggests that we're not going to see anywhere near the number of deaths relative to the number of cases that we're seeing, if you compare that to previous spikes or surges in cases, because the vaccines have been so effective at keeping people safer. So the vaccines are really important for keeping people from dying, certainly. They also reduce the likelihood that the virus is going to have places to go. Because even though it's newsworthy every time there's a breakthrough case, the fact of the matter is the great majority of vaccinated folks are protected against this virus. And so it is preventing the ongoing spread. But I think one of the best arguments, if you're thinking about how to message, connect, and communicate with the Black community in particular, it's that the vaccines are our path back to normalcy. We're going to keep having these moments where we say, oh, cases are surging and you need to be extra careful and you need to take these additional precautions, unless we get to a point where this virus has nowhere to go. We're going to keep seeing new variants every time this virus has the chance to replicate inside of a human host. That's where it makes copying mistakes, creates new variants, and those variants can be more damaging. And so we're going to keep telling this story until we have a population that has sufficient immunologic protection against this virus, so that we end what we're seeing in this current pandemic. And so the arguments can certainly be to prevent folks from dying, but also to get things back to normal.
Thank you. We have a lot of questions. I'm going to try to go through these pretty quickly, but Doctors Villanueva and Michele Benoit-Wilson, please feel free to complement any of the answers or chime in on the ones that you would like to ask. Another one, just if we can dive a little bit more deeply into the difference between an FDA approved vaccine versus emergency use authorization.
Sure, I can take first pass at this one also. I think from the FDA standpoint, it was critical to us that once we knew that vaccines were safe and effective, that we can get them out to start saving lives. So, yes, when that FDA emergency use authorization came through in December, we had lots of data. In fact, there were over 75,000 people in the trials for Pfizer and Moderna. And between them, we had a lot of data on how safe and effective the vaccines were. And so that was part of what went into getting that emergency use authorization. Some of it is the time course. You need 2 months worth of data for an emergency use authorization, but for full approval, you need 6 months worth of data. And it often takes at least 6 months to go through all the additional data. The full approval process also requires going to the facilities where the vaccines are being manufactured. It's a deeper dive, a deeper look, and also following a longer time course. I'll tell you this, every public health expert that I've talked to, every expert in infectious disease or who's virologist, a lot of folks who've been looking at this very closely, they fully expect that these vaccines are going to get full FDA approval. It's a matter of completing that review and making sure that that process, we're not cutting any corners, and that process is executed thoughtfully. And that could happen anytime now. I keep hoping, crossing my fingers, hope this is going to happen any day now, because I know that, you know, upwards of almost a third of the unvaccinated individuals say that hearing that there's full FDA approval will make a difference for them. So yes, we're waiting, we're eager to see that happen. But in terms of our confidence in the safety or efficacy of the vaccines, you know, for those of us in the medical field, it doesn't really change our confidence, because I think the data that we were looking at that went into that emergency use authorization was clear. And also, we've got almost 167 million people who are fully vaccinated at this point, where we have a richness of data availability. So we've been watching this really closely. I think we feel very confident in the safety and the efficacy. But I think that that full stamp of FDA approval, that's going to help, you know, move a couple more people toward it. I always push back when folks say it's an experimental vaccine. I think that's pretty far from the truth, but I understand that some of it's in the nomenclature from FDA, and want to make sure people know everything that went into getting even that emergency use authorization.
And then we have a two-part question. I'm going to combine this, and perhaps Dr. Benoit-Wilson can take this one. If a pregnant woman has tested positive for COVID, what precautions or medications should she take? And then Dr. Villanueva, there's so many questions about fertility for both men and women. It would be, I know you touched on this previously, but I think we'd like to revisit that, since that is something that comes up quite a lot, and especially in our young adult population.
Yeah, so to start with, if a pregnant patient were to test positive for COVID, then she would do exactly what a non-pregnant person would do, which is to monitor for symptoms and also alert her healthcare provider so that they could make a determination as to what her needs would be based on the severity of her symptoms. There are some medications that are available that have been studied and used with the alpha variant of COVID with regard to monoclonal antibody medications. Those medications there are different recommendations now with regard to the Delta variant because it does act differently. So that conversation would need to be had depending on what her symptoms are. But certainly we do know that the long-term, the acute and the long-term effects of COVID infection are far outweigh any potential impact of the vaccine. And so the most important thing is to prevent by getting vaccination, and vaccination is safe at any point of pregnancy, including the first trimester. We just want to stress that there is no pregnancy-related reason for why someone should not get the COVID vaccine. Prevention is going to be key.
And I'll just pick up from there. As far as fertility for women, I don't see men ever, so I'll just speak about women, but it translates to men as well. I really get this question at least, I don't know, 5 times per day in my practice. The vaccine has no effect, negative effect on fertility. We have real world data for patients who had taken the vaccine and became pregnant afterwards. And as we get more information and data from women, that it will just be substantiated in that way. But we have not, there's no reason for anyone contemplating pregnancy in the first trimester, as Dr. Benoit-Wilson stated. I got a lot of patients saying that they've heard it causes miscarriages. It does not in any rate that's outside of what you would normally expect in a general population. So we know, again, that these vaccines are safe and effective. And what's really should be on the concerns of people who are wanting to get pregnant or who are pregnant is actually getting COVID-19. So that's the risk. That is the real risk for our community.
I just want to add really quickly, because I think sometimes it's important to know where the misinformation comes from. And there was a blog post in the late fall from a scientist in the UK who said that there's a protein so the spike protein on the COVID virus, the SARS-CoV-2 virus, is similar to a spike protein on a human placenta, and the similarity may create some cross-reactivity if you have a vaccine. It was kind of posing a question that got picked up by an outlet in Germany, and it really took over on social media. And a lot of people were saying, oh, this can cause issues with fertility. The vaccines can attack the placenta. There were several studies that were done that looked at the similarity between those two proteins and said there wasn't sufficient similarity. That protein is called syncytin 1, if you're interested in looking into that a little bit more. So from the scientific community standpoint, it's been asked and answered. We feel really comfortable that, yes, that question was posed and it's been answered, and we no longer have that concern. It's just once it gets a life of its own in social media circles, really the myth becomes larger than the original question. So I like to share that as often as possible so people know that it didn't come from nowhere, but it's been asked and answered.
And can I also add that one of the questions that I get frequently in my practice is, well, I thought it was safer to get the vaccine after delivery. And that's also been proven to be incorrect. I always take the time to tell my patients that getting the vaccine during pregnancy is actually not only safer for the patient, but also safer for the baby itself. We have the benefit of research that has been done on pregnant women, primarily healthcare workers, because we received the vaccine first. And we actually know that a pregnant woman produces more antibodies that get transferred to the baby while she's carrying the baby than the antibodies that she would be able to give the baby during nursing and after delivery. So I'm hoping that that message gets out as well, that not only is it important for us as moms who are, of course, always concerned about the effects of anything to our pregnancy, but there's actually a significant benefit to getting vaccinated during pregnancy.
Thank you. I'm going to try to get through two more questions. I know it's ambitious in the 2 minutes, but I think they're important. And anyone can feel free to jump in and complement each other's answers. There's a question about the concern of children contacting Delta variant and the outcomes. And the sort of the related question is, how do we help improve vaccination rates then amongst the Black community? And a third question is, what is the most effective messaging? I think everyone, like you just mentioned, as moms, as parents, we want to protect our children. There are a lot of questions. So I will just open that up with three questions in one and 2 more minutes. And then we'll get to the rest of them over email.
Oh, really quickly on children, what I would say is that because older people aren't getting as sick, we're not seeing hospitalizations and deaths in older folks the way that we were. You are seeing younger people make up a larger proportion of hospitalizations, but it's not necessarily that the Delta variant inherently is making young people really sick. I think what's important to keep in mind, though, is that if you're under 12, you have no protection whatsoever. And nearly 500 young people have died, kids have died from COVID-19. And that's not an insignificant number. And so I've got a 9-year-old and a 6-year-old, and as soon as they are eligible for a safe and effective vaccine, we're going to make sure that those kids get those vaccines, because we want to make sure that we're protecting our kids. So that's what I'd say on the kids piece. They're still the most exposed because none of them are eligible for vaccines under 12. But I'll pause there and see if one of my colleagues wants to answer one of the other ones.
Well, I will share that one of my pediatric colleagues, I think, said it best when we spoke about the importance of masking in schools to protect our children who cannot get vaccinated. And her response to the myth that children are not affected by this virus was that I want more for my patients than just not dying. And I think that really resonates with people because there are more long-term effects to this infection to our children with regard to long COVID symptoms, development of diabetes, and also potentially infecting more vulnerable people who are in their household. So I think it's really just focuses on the importance of all of us around these children to be vaccinated.
And just to close, I think that point of what messages break through, Dr. Benoit-Wilson is spot on. For young people, it's not that we're focused on them surviving the pandemic, because the great likelihood is that they will. It's that we want them to thrive. We want them to be able to have the experiences in their lives that bring them joy, that give them that socialization, that give them the opportunities to have that robust, wonderful childhood that we all want for our kids. So that's what's important there. For older folks, it's really zeroing in on the safety and the efficacy of these vaccines. The misinformation is that the vaccines are in some way unsafe. That couldn't be farther from the truth based on the data and the science that we have. I always say there's a reason why, Dr. Villanueva and myself, why we got our mamas to get that vaccine, right? It's not because we're flying blind here. It's because we saw the data and we believe in it as physicians, as clinicians, and that's important to see. And so I think it's really just making sure that you take the time to get that correct message out to people and it resonates.
Well, there are so many more questions. I think it's a testimony to the importance of this work, but our doctors are very busy, and I just want to thank you from the bottom of our hearts here. I can speak on behalf of the administration for the important work that you're doing. I know that you'll go off and continue to answer these questions in the communities, and you're making such an impact. Daryl, I'm going to pass it back to you, and we thank you so much for being here. Daryl's email is in the chat. Feel free to reach out to us, and we'll continue to answer questions. Thank you.
Thank you, Georgetta. Great way to culminate the Q&A session. It was great with Dr. Webb's comments, talking about the Delta variant. So many good things that we're getting the information out, dispelling myths. And before we culminate, the work is not done, as we can see that. Share the information with your communities, your families, your loved ones. Nelson Mandela reminds us, it only seems impossible until it's done. That's our call to action, and we can push through the pandemic. Each one, reach one, a person in a community, and you can really make a difference. I'd like to thank Georgetta Dragayu for teaming up with us at the Q&A. Great job. Thanks to Dr. Cameron Webb, Dr. Rachel Villanueva, and Dr. Michele Benoit-Wilson. You're the trusted Black messengers, amplifying all the positive and accurate information. Your inside information and care, very valuable. And please reach out to me at Daryl, D-A-R-R-Y-L, at cmredge.com with any questions, things you'd like to know from me. I look forward to teaming up with you, and let's keep that conversation going. And as the COVID-19 mantra reminds us, together we can do this, together we will do this, and we must do this. Stay safe, get vaccinated, practice those health safety measures we know work. If you haven't already, get vaccinated, that's the key. Have a great day, and I look forward to teaming up with you to talk to you soon.